Well, hey guys, happy Vlogtober Day 13 and welcome back to the Friday Q&A. As promised last week, today I'm going to be talking all about finasteride, which is also sold under the brand name Propecia. This is going to be the last of the videos in my hair loss series, and next week we'll continue with just regular skincare Q&As. I previously talked about female pattern hair loss, postpartum hair loss, and so if you're interested in those videos, I have them in a playlist entitled Hair Care Q&As, and they're also in my skincare Q&A playlist, and most of them are listed down below in the description box. But in today's video, I'm going to be talking specifically all about your most frequently asked questions with regards to finasteride or Propecia. And if you're new here, welcome. My name is Andrea. I'm a dermatologist. I post day in the life of a dermatologist vlogs, as well as skincare product reviews, fun recipe videos and lifestyle tips, as well as skincare Q&As. So if that kind of thing interests you, I encourage you to stick around for more. Just have a little bit of tea here to wet my whistle. So in my male pattern baldness Q&A, I talked about how the other name for male pattern baldness is androgenetic alopecia. And essentially, androgenetic alopecia is an androgen sensitive disorder. In other words, it's due to androgens, or the male hormones known as testosterone. Dihydrotestosterone is a very potent metabolite of testosterone, and it actually is what is the causative hormonal component in male pattern hair loss is dihydrotestosterone. The hair is, for whatever reason, perhaps due to genetics, most likely due to a variety of genetic reasons, the hair follicle is just very, very sensitive to that hormone, dihydrotestosterone, and prematurely turns into a little baby hair and results in ultimately hair loss. And I also mentioned in that Q&A that dihydrotestosterone is derived from testosterone under the action of an enzyme called 5-alpha reductase. Okay, so in order for dihydrotestosterone to form, 5-alpha reductase activity is necessary. And so finasteride, or Propecia, is a drug that blocks 5-alpha reductase. It's a 5-alpha reductase inhibitor. It inhibits that part of the pathway of male pattern hair loss. By reducing dihydrotestosterone levels in the scalp, finasteride helps to decrease and remove the effects of dihydrotestosterone on hair loss in men. So finasteride is indicated for men with male pattern hair loss, and specifically for slowing down or stopping male pattern hair loss and promoting hair growth. And it can decrease the levels of dihydrotestosterone in the scalp by 60%. And likewise, it can decrease levels of dihydrotestosterone in the serum of your blood by 70%. So it's quite effective at blocking conversion of testosterone to dihydrotestosterone. How is it administered? Well, it's given as a pill that you have to take once a day. And the typical dose is 1 milligram, and it's best taken with food. So I get many women asking, well, can I use this drug? So finasteride is not indicated for women who are in their childbearing years. In other words, if you're contemplating conceiving or there's any chance that you might become pregnant in the near or distant future, finasteride is contraindicated because finasteride does have the potential to cause birth defects. So then most people want to know, well, how well does Propecia work or finasteride work? So we have data from 3 large multi-center trials with placebo control of 1,879 men with moderate androgenetic alopecia, meaning not complete hair loss, but moderate hair loss. And this group of men were randomized, in which some of them randomly received finasteride 1 milligram daily, or some of them randomly received a placebo pill daily. And the endpoints for the study were the researchers objectively looked at 1-inch diameter circles of the scalp, counting and took hair counts during the study. And these trials demonstrated that finasteride can prevent further hair loss in men with androgenetic alopecia, specifically in men with mild to moderate androgenetic alopecia, because that is what the subjects in the study were. And in 2 of the studies in men with mild to moderate hair loss, 86% of those men treated with finasteride or Propecia maintained or showed an increased amount of hair growth. And 14% of men who got the finasteride or Propecia pill continued to have hair loss 12 months after taking it consistently. This was in comparison to the 58% of the placebo patients who continued to have hair loss on the placebo pill. And for those of you who aren't familiar with the term placebo, it basically just means like a sugar pill that has no drug in it. And since those studies were done, we now have more studies that are showing that finasteride can effectively reduce continued hair loss in men, specifically in 9 out of 10 men taking it consistently. So it's quite effective. Occasionally people say they don't respond to it, so sometimes I get questions in the comments below, well, I didn't respond to it. Is there something wrong with me? It's difficult to predict who will respond to it. Bear in mind, though, that the subjects in the studies were men with mild to moderate hair loss, so perhaps individuals with complete hair loss, it's just not known how well finasteride would work in those cases. But I have seen it be effective myself, so there is the potential. So how quickly does finasteride work? When can you start expecting to see it? Well, as everything in dermatology, it's a little bit slow to get started. Things in the skin take a long time, and things in the hair, in the realm of hair growth, take even longer. So you pretty much have to take it every day for 3 months before you start noticing any effects. And then as a natural follow-up to that, everyone wants to know, well, how long do I have to keep taking this then once I start seeing the effects? Well, we have no controlled trials of treatment longer than 12 months. However, it's probably necessary to continue the pill indefinitely to maintain the benefits that you may observe with this medication. So then the follow-up question to that is, well, what happens if I stop taking finasteride? Will my hair just fall out? So if you stop taking the finasteride, the dihydrotestosterone levels in the scalp will rise, and the hair loss of the androgenetic alopecia will commence, and hair loss will continue. Will it grow hair on other parts of my body? So finasteride is a 5-alpha reductase inhibitor, but more specifically, it inhibits one variant of the 5-alpha reductase, 5-alpha reductase 2. And that particular variant of 5-alpha reductase is found most predominantly on the scalp. And so in clinical trials, there was no reported hair growth in other areas of the body. So no, that's not likely. All right, and then everybody wants to know about side effects. This is a pill that you're taking. Is there anything dangerous that can occur with a pill like this? What are the most common side effects? So in clinical trials, finasteride was very well tolerated in the majority of the men taking it, and there were really no serious side effects reported. The most common side effects that were reported were decreased libido. So 1.8% of men reported a decrease in libido in comparison to the 1.3% of the placebo men. Also, 1.3% of the finasteride treated men reported erectile dysfunction in comparison to 0.7% of the placebo group. And one other side effect that has been reported is gynecomastia, which is the medical term for breast enlargement. And all of these side effects, the gynecomastia or breast enlargement, the decreased libido, and the erectile dysfunction, all resolve with discontinuation of the medication. So those are the side effects that were reported, but then everybody wants to know, is it safe to keep taking this for the rest of my life? What are the risks associated with inhibiting this enzyme? Is there anything I should be worried about? I've heard about prostate effects. What's the deal with that? Well, suffice it to say that blocking dihydrotestosterone formation has no long-term health consequences. We have good data for that dating back to the 70s because there is a subpopulation of people who actually are born with a deficiency in this enzyme, and they're perfectly fine. So it's not dangerous to your health to go without this enzyme activity, and the enzyme being 5-alpha reductase. With regards to the prostate, however, finasteride can result in a 50% decrease in the prostate-specific antigen, which is, or the PSA. And if you're not familiar with that, PSA is a blood test of kind of prostate health, and specifically high levels of PSA are potential clues of a prostate cancer, okay? So what you should know is that finasteride will lower this by 50%, and so it's very important to tell your healthcare provider that you're taking it so that they adjust for that if they measure this level to make sure that they're not underestimating the prostate-specific antigen, okay, if that makes sense. And so everyone becomes alarmed about taking this medication and the risk of prostate cancer. To date, we really don't have any evidence to suggest that this medication is causative of any type of cancer. So are there any contraindications to taking finasteride? Well, I mentioned already that women of childbearing age should not take finasteride. Occasionally it is prescribed to postmenopausal women who are done with childbearing to treat female pattern hair loss, okay? Occasionally it might be prescribed in those settings. For the most part, it's not prescribed for women of childbearing age because it does cause birth defects. Also though, men who are struggling with fertility themselves, subfertile men, should not take this medication. It can lower the sperm count. So oftentimes men who are about to start families who are taking the medication, their doctor might check a sperm count before starting the medication, and then at 6 months into taking the medication, and if the sperm count is lowered substantially, then it would be a reason to stop taking it, and so that you can go about your family planning. And I also get questions, well, I take other medications, can I take this? So far, finasteride does not appear to interact with any medications. But I mentioned in my male pattern hair loss Q&A, I think that in male pattern hair loss, one treatment that is frequently recommended is minoxidil or Rogaine. And if you missed my Rogaine Q&A, make sure you check that out. It's down in the description box as well as the hair Q&A playlist. But sometimes men taking finasteride will also be using minoxidil. So that's another potential route, is to have the two going at the same time. Specifically the 5% solution of minoxidil, which you can get over the counter, and Costco sells it for a pretty good deal. It's either the brand name Rogaine or the generic minoxidil. They're both the same thing. So if that's been recommended to you, then go with the one that's most affordable. All right, guys. Well, I hope that answered all of your questions about finasteride for male pattern hair loss. And I really hope you guys enjoyed the hair loss series. There are certainly far more topics in the realm of hair and hair loss that I can address hopefully in the future. But for this kind of segment of time, I wanted to keep it contained within these topics. And I can add to this playlist at a later time. But for now, I'm probably going to switch gears over the next few weeks and switch to another topic. But really what I want to emphasize to all of you guys is that, and guys and gals out there watching these videos, is that hair loss is not merely a cosmetic issue. It has profound effects on your overall health and well-being. Studies have shown that individuals with hair loss can suffer higher rates of depression and poor self-esteem. And if you're really struggling with feeling, down about this, I want you to, you know, I'd encourage you to think about talking to somebody. I posted a video earlier this week on World Mental Health Day about an app that I'm rather fond of called BetterHelp. I'll list it down below in the description box if you're interested. But what I really like about this app and this site and this service is that it offers affordable and accessible and privacy protected counseling that you can access from your phone by a variety of different communication styles. So, you know, when you're struggling with these things, don't feel as though you have to go at it alone. I know it can be incredibly difficult to get in to see not only a dermatologist, but other healthcare providers, and let alone a counselor. So I encourage you to check it out if you're interested in that, because as I said, hair loss is not merely a cosmetic issue. It definitely can impact your overall well-being and your sense of self. So don't deny yourself that. And I hope these videos were helpful to you guys. If you liked them, give them a thumbs up, share them with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.